Deputy McConalogue, thank you.
Thank you to Deputy Kelleher for placing this motion before the Dáil tonight in relation to the inadequacy of the 2015 HSE Service Plan, which was put forward during the past week. And at the outset, Minister, I would like to first of all comment on the HICWA review of the ambulance service and emphasise to you the importance in particular of investing in increasing the number of ambulances in different parts of our country. I know it indicated difficulties in relation to the coordination between hospitals and the ambulance service, which need to be addressed, but also, Minister, there is a very definite need for investment in our ambulance service, particularly in areas outside of Dublin where there are large areas to be covered, and in the absence of ambulances and staff working in those areas, waiting times and response times are impacted. And this no more so, Minister, I would like to comment on the incident particularly in relation to the death of Maura Porter on New Year's Eve last year, and the experience of her family. And she's but one of many other families, their family, who have been impacted by the lack of coordination on one side and also by the need for additional investment. But in relation to the service plan, Minister, I want to specifically focus tonight on its impact in Donegal in particular and Letterkenny General Hospital. And the experience in Letterkenny, is replicated across the rest of the country. And we have at Letterkenny General Hospital, Minister, currently over 2,400 people waiting for more than a year for an outpatient appointment with a consultant. And that's gone up by 1,500 patients in the last 6 months alone, waiting more than a year. We also have 3,000 people on the surgery list there. That's the official hospital figures as I've got through putting down parliamentary questions to you. Unacceptable, and not the type of service, Minister, which people across the country and people in Donegal should be expecting from our health service. But I want to specifically zone in tonight on those who are affected by the outpatient waiting list initiative, which the HSE, alongside your department, came forward with this time last year. Because in relation to Letterkenny in particular, there was approximately 3,000 patients, Minister, last year outsourced from 2,700 to be precise, outsourced from Letterkenny General Hospital to private hospitals to be seen by a consultant. And these are patients which are separate to the numbers I gave you earlier on, separate to the hospital waiting list. Out of those, about half were either treated or discharged back to their GP. But there is another half, 1,300 of those patients, Minister, who have been left in limbo since last year with no follow-up treatment. 1,300 patients across the country who, over a year later, after being outsourced by the HSE to a private consultant, to a private hospital, have not had either a follow-up test with those consultants or indeed the surgery which it has been indicated and reported back to the hospital that they require. And there is no funding set aside in the HSE Service Plan to address that. And I would hope and ask that in your response this evening you will deal specifically with the issue of those patients who were on the waiting list initiative last year and what is going to happen to them. Because it has been indicated to me, Minister, in responses, that there is a likelihood that those patients will now have to go back onto the hospital waiting list and that they will not receive the follow-up treatment that they require with the consultant they were initially referred to, which will mean that outsourcing and visit to that consultant will have been a waste of money in many cases, because they will have to be seen by the internal hospital consultants again before appropriate follow-up treatment can be arranged. And it is totally unacceptable that we would see a situation where the government are prioritising putting funding towards what you regard as election-winning measures in relation to tax decreases at the higher rate of tax, Minister, when you are not addressing a very serious issue there or allocating funding in order to actually ensure patients can be treated. So I would ask that you address it, Minister, in your response tonight, and also that you would come back to me with specific answers as to how those patients their needs are going to be addressed. In a relatively small one county in the country, over 1,300 patients sitting in limbo over a year with no indication as to how they are going to get the tests they require or the operations they require.
Thank you.
Unacceptable, and it needs to be addressed immediately. And I would ask, Minister, if you can't address it tonight, that you revert back with specific proposals as to how that can be done, because they cannot be left to continue without any follow-up treatment, which is where they sit at the moment.
Thank you.